Christine Crow is a young woman who has struggled with the visual and perceptual problems associated with several neurological conditions, including concussions, seizures, and Lyme-related infections. As you can imagine, this has affected her school, her work, and her family life. If you or someone in your family experiences difficulties with visual perception, headaches, light sensitivity, vestibular issues, and similar side effects, then visual stress may be a contributing factor. I hope you enjoy this interview with Christine, and make sure to stick around to the end so you find out how she worked with her medical team and Opticom to find how she puts it, a big piece of the puzzle. Here's Christine's story. I'm so happy to have you here. You were one of my favorite clients in the last 6 months because of how excited you were about how everything was helping you. And what I found was you have such a great story to share, the things that you've experienced and what you've gone through to identify what it is that's triggering you and following up on your concussion. I really think you have a lot to offer an audience listening to.
Great. Thank you very much for having me, Karen, and I look forward to chatting today.
So I have quite a few questions. We talked about these. I guess the first one would be, give me a little bit of a history of what led you to us. You've been through a lot of steps, but give me a little history about how you ended up with Opticom.
Yeah, so back in 2013, I was in 2 car accidents. So I sustained 2 head injuries, concussions, which eventually led to my diagnosis of post-concussive syndrome. I had a whole slew of symptoms that came with concussion, but I really had a lot of visual symptoms that no one was really able to pinpoint over the years. I did a lot of different therapies, including vision therapy. I worked with 2 different vision therapists. I was in all sorts of glasses and prisms and did vestibular rehab, and things just kept persisting and changing over the years, and it was never got back to normal how I was before. So I kind of was just always still looking for the answers with the vision, because I just felt like there was a missing piece there. And so when I found you guys, I just didn't understand why it wasn't more popular. And I thought that it would have really complemented the vision therapy, because I did make progress with vision therapy, like significantly, but it just wasn't 100%. And I think that the glasses would have actually really enhanced that process. So yeah, and then last year I actually started having non-epileptic seizures, and one of my big triggers was lights. So the glasses have really helped with that, and that's kind of what brought me to you, was the seizures. So yeah,
that's good. I wanted to address what you said about Prism's vision therapy, and we'll talk a little bit about why it's not included in that process yet.
Mm-hmm.
But what we found here with the optometrists in Ottawa that work with us is it absolutely goes together. If we can reduce the stimulation of the brain because of lights and patterns, then the effectiveness of whatever vision therapy you're doing will be greater and faster. That's what we found. Mm-hmm. It's almost like if we could relate it to prescription glasses. If we were trying to get you to read something without your prescription glasses, you would struggle. You'd still learn to read. You'd still be able to see the text. You might have to squint, but you'd be more uncomfortable. As soon as you have the accommodation of the prescription glasses, okay, now you can read, you can learn better. So the way the prescription tint works is it relaxes the brain so that you can then go on and do that therapy. And we do put precision tint with prisms as well. Prisms have been found to be very helpful for some people, adjusting their midline shift, bringing in a balance that they wouldn't otherwise have without the prisms. And when we put the prism with the tint, it just makes their whole world calmer, and the brain can now start to adjust to those prisms. So that's been something that's been helpful here. Now, why isn't it everywhere? Why aren't people understanding this and incorporating it into their vision therapy or optometry? Is that, precision tinting and colorimetry is not yet very well recognized, or people aren't just aware of it in Canada. But we are definitely working at changing that. By having the clinic in Ottawa, and we've been, since 2015, we have been seeing concussion, learning difficulty, and migraine patients, and others with like Lyme disease, as you mentioned. We've built up a really great database of results, and we are bringing the medical device to Canada. It's in with Health Canada right now. So that medical device that we use to determine your effective tint will then be available to sell to optometrists across the country. So I know you saw people in Toronto, I believe.
Mostly in London, but
Okay.
I have traveled. Actually, I've been seen in Guelph, a little bit in Toronto as well.
Okay. So we have had interest from those cities, and the great thing will be is once we can get the equipment out to optometrists, especially those who are focused on that concussion and sort of extra vision care post-concussion, that is the vision therapists and the vision specialists. That it's not just a regular eye test. They go into much more detail. So I think that's going to help people like you find out about the effectiveness of color earlier on in your treatment, in your rehabilitation.
Yeah, for sure.
All right. Christine, you mentioned that you had been through vision therapy and prisms, and then you got the lenses. What would you say would be your most noticeable differences in getting the precision filter? What kind of changes did it make for you?
Well, I got my glasses actually in a very busy place, because we were when I got them, the day I got them, I was going to an event with a lot of people. And so I was excited to get to try them out. And I noticed just instantly that it was just easier to be in the bright lights and the room full of people, which would normally be quite a hard environment for me. And as you mentioned about kind of how it just calms the brain down. I find post-concussion, you're always compensating, you're always overcompensating, and like my visual fatigue has just always been really high. And so it really helped calm the entire environment down. And I found that my stamina, especially on the computer, really went up. I'm able to be on the computer a lot longer than I was before. And my sleep, I think, got more regulated. I think it really helped with like the circadian rhythms, and they are the first thing I grab in the morning when I wake up, and I wear them right till I go to bed. And so I think they really helped kind of regulate some of that for me as well.
That's great. The statement you made about being able to be in busy, bright lit environments, we hear that a lot. I've actually had clients call me. One of them called me from a lighting store. She was shopping with her sister for lights for their new home. And she called me and she said, I can't believe I'm actually in a lighting store right now. And you know what those are like glare and shine and crystals. So that was great. And another one called me from Walmart. She said the last time, before getting her glasses, she had been to Walmart and she actually had a seizure. It was the lights, the movement, the cash register, the noise, everything. She collapsed. And so she was afraid to go back. And so she called me the first time that she had been brave enough, I guess, to go back to the store. And she called me after she went through, and she said it was like night and day, this ability to tolerate the overhead lights and the patterns. So that's great to hear from you.
I noticed this with the lights for me at night. If I was ever walking at night and there was cars coming, that used to put me in an instant seizure. And if I wear my glasses, I'm good now. So that's nice.
That's great. That's great to hear, because a lot of people ask us, will this help with lights? And I just want to add a little bit right now about all of the new headlights that are coming in on the new cars are the LED lights. So instead of the old incandescent or whatever they were, they weren't LED. And if you were to video some of these headlights and slow it, you would see a pattern of flicker going all the way along those lights. It's not a steady light, it's moving. And with visual stress, the flickers are patterns, light, movement. And what do you have when you're and flicker, and what do you have when you're out driving at night? Movement, light, pattern. The pattern and flicker go together. So it's understandable that a lot of people with concussions and head injuries and migraines are having trouble, but it's also affecting people who don't have head injuries. Those lights are very difficult for people to tolerate. You're ending up having to look away, and that's dangerous when you're driving. So hopefully they'll make some changes to those lights, and they'll produce better quality lights so you don't have that kind of movement and flicker. did bring this up with a member of the it's a community of lighting specialists around the world, and I mentioned that this was happening and people were complaining, and the comment was back, it will get worse before it gets better. It'll get worse, people will complain, they'll study it, realizing how much of a problem it is, and then they'll make some changes. So we can't expect that to happen anytime soon. So it's great to hear that by wearing your glasses, it reduced the effect of those headlights.
Yeah.
That's good to hear. I could also add a little bit about nighttime. People, like your tint is about a mid-saturation. Some people have darker saturation, some lighter, but they always ask, oh, can I wear these at night? Tell me about how this feels. Does it really darken everything, or does it make things easier to see? Those are the comments.
Sometimes in the night I do take them off, but if I'm working, if I'm doing computer work, they'll be on till I go to bed. If I'm going to go for a walk and it's in a park and there's not going to be cars, I do try to get some natural light in.
Yes, that's good.
Because sometimes at night sometimes they can feel a little bit dark. But it just depends on the setting where you're in. If I'm going to be in a bright environment, if I'm going to go shopping, if I'm going to be on the computer, I'm for sure going to have my glasses on. So just kind of pick and choose. But for the most part, I have them on in the evenings.
That's a really good point. The fact that you can moderate your visual environment. Once you learn about the triggers in your visual environment, then you can modify them. You may not need to wear the glasses all the time. You might just put the light on a certain tint if you have the tinted lights, or you've got low room light and you're okay just to relax in that low light. But as soon as the lights go on and you're in busy, high action environments, putting the glasses on is great. Yeah, because people ask us, how often do I need to wear these? And our answer is usually as long as you feel you need to wear them.
Yeah, I think it just becomes very intuitive. Like in the beginning, I was wearing them all the time, and then I still wear them for a majority of the time, but I will take little breaks here and there when I feel like I want to.
Yeah.
Or I might think, oh, I want a break right now, and I might take them off. Be like, nope, this isn't the right time. Let's put them back on. Well, so you just kind of get intuitive with it, I think, as the time goes.
Yeah, that's good. And that's what we do tell our clients. And when we're following up with them, they may say things like, I find the room is too dark now. And that means that maybe their brains are becoming more tolerant of the light. So you may not need to wear them as long. And we do see people back, especially those who are concussion, because their brain is healing. We do see them back about, I'd say, well, sometimes within a year, to reduce the saturation of their tint and to get them in something lighter. We may have put gray in initially because it reduces the overall amount of light, and maybe that gray can come off now. So it is true that as you heal, you may become more tolerant and your tint may change. Just like when you were going through vision therapy, you probably worked through your prisms. Yeah. Okay. Talking about optometrists, and how do you think, what ways do you think we might be able to approach or attract more interest from all those medical field specialists that you were working with?
I think it's really just education and showing case studies and patients that you've had. And especially if you've had a patient who's done vision therapy with the lenses, and compared that to a similar case who didn't have the lenses, I think it would be quite a drastic difference. And to be able to speed up that healing process. And when you were talking about how specifically with concussion patients, the tint seems to lighten over time, that's a really good indicator, not only for the patient, but also for the provider, the healthcare provider, to see the progress being made and to know that the brain is actually getting better as that tint starts to lighten. So I think just providing case studies and education for them, and teaching them about the colorimeter, because I think tinted lenses are becoming more popular, but I think you guys bring something really unique with the colorimeter, because it's so specific. And I didn't realize all the different kinds of light and all the colors. And, you can have two patients with the same condition who will be in totally different colors. And I think it's really important that the patient gets the right color and they're not just kind of guessing, because I think sometimes that can cause more harm than good in the recovery.
Actually, that's a really good point. And I find that the harm is they're wearing something that isn't their proper filter, but their doctor told them to wear it. So it may be something that actually causes them more discomfort, because
Mhm.
it in the moment of the testing in the 5 different colors, it was best, but you saw how specific we are in when we narrow it down. We've also had some optometrists use the overlay, the plastic overlay, and try and convert that to a lens color. And there's a lot of research showing that that is not the case. For example, I had a little girl come in today and her color was blue, a dark blue for her overlay. Well, her precision tint was a turquoise blue. And if I actually had her in a blue tint similar to her overlay, because I was showing the mom, and she's like, no, she didn't want to wear that tint. So if I made her wear it because I said, oh, you're blue, then she would have had difficulties and being frustrated. But also, they would have thought that filters don't work. And I think that's the worst message, is it does work. You just have to get it right. So if you're telling people that it doesn't work, then there'd be people like you out there who are like, okay, they don't have that option because they didn't find out that it is precision that you need to have.
Yeah. Well, I was told to wear like a yellow orange like years ago. Like, and one of my doctors was like, get some like just construction glasses off Amazon, like orange, yellow, and I'd put them on at night. And then when I came in to you guys, I thought I was going to be a totally different color at the beginning of the assessment. And then I find it's hard to really pinpoint. It's hard to explain visual stress when someone's like, what are your symptoms? And it's really hard to explain. But what I found in going through the testing, it was like, oh, I guess the words do move and this does happen. But you learn to compensate over time and it becomes your new normal. So you just know, for me, it's just my eyes are tired all the time. I have to go to sleep. Like, it's just too much visually. And so I think, with that assessment, you're able to really not only pinpoint the exact color needed for the patient, but also for them to kind of get some more awareness about what's triggering them in their environment.
Yeah, that is an excellent point. And that's why when we do the assessment, and even before the assessment, when we send out that visual stress symptom index, I say to the individual or the parent, I want you to think about each one of these questions because you may not have thought of it before. And the main one is, are you sensitive to patterns? No. Mm-hmm. Have you thought about it? Okay, look at some patterns. Think about an escalator. Think about someone wearing a certain outfit. And then it starts clicking. And then they're like, oh yeah, when I did that. Or this one gentleman came in and he was saying how, oh no, I'm not sensitive to patterns. He goes, but when I went to my daughter's house and I was sitting on the couch, she had this awful painting on the wall. I had to move and turn and look and on the other couch. I said, well, what is the painting? He goes, oh, it was a bunch of like fence posts. Okay, so that's a pattern.
Yeah.
And you were uncomfortable. And so you moved, but you didn't think of why you moved. And so part of the assessment and the pre-assessment is helping people understand what it is that's triggering it. Once you understand it, then you can make some changes.
Yeah.
Actually, you're doing something similar. You've been going through all of this healthcare for yourself and studying neuroscience at university, and now you're looking at those experiences and taking that forward to help others. And tell us a little bit more about that.
Yep. So I'm going into my third year of neuroscience and psychology, minoring in psychology. And I had actually started in cognitive science, but I was really drawn to the neuroscience, and with my background and experience with concussions and then with the seizures, it's not fun stuff to live through, but it is really fascinating to learn about. And so I've been just on a journey learning about that. And obviously with my personal experience, I've done lots of research outside of school for more of those kind of tangible things that you can do to, feel better and just help along with the recovery.
That's great. And I'm so happy that our journeys together met at one point.
Yes, for sure.
So I'm going to look back at my questions again.
That's okay.
Christine, can you explain sort of the different environmental triggers that you experienced, and what have you done to effectively navigate your visual stress in those environments, aside from your lenses?
Yeah, before I got the lenses, for me, it was a lot of pacing, was taking a lot of breaks and being really strategic with my outings. Like if I knew I had to go out to a busy environment, I wasn't gonna, have a whole jam-packed morning at home, and I maybe would have to get ready and then have a nap and just really be prepared for those times, and then to minimize the times that I'm out. And taking breaks. If I was, at an outing with family or something, I might have to go sit in a quiet room here and there. And so just reducing the stimulus when I can. And for me, it was a lot of sleep. Was a big napper, still I'm a big napper. And just really was just pacing. And then with throughout vision therapy, things went up and down with vision, and they have over the years. Even with the lenses, things go up and down as other things happen in your life. And just kind of taking things as they come. For me, like I said, some days I'll be in my lenses from first thing in the morning till right time in the bed, right till I go to bed. And other days there might be more breaks in there. And luckily with this, I'm able to withstand, events better. But with COVID, we haven't been out as much, so I haven't got to test them as much as I had hoped. I was excited to see what they were going to be like in the classroom, because post-concussion, one of my biggest problems was looking from the board to my computer or my notepad. That was a really hard eye movement for me to do. My one eye droops down quite a bit and was turning in really badly. So I did correct that with vision therapy and just maintaining. If you feel things slipping, I have my exercises and stuff like that. So.
Good. Yeah. Meditation, focusing.
Yeah,
all
meditation
those things.
for sure. Yeah.
You mentioned pacing. I have started, actually it was about a year ago, a YouTube channel called Concussions Anonymous. I do it with a friend of mine, Lisa Cara. She has suffered a concussion, and she is a Pilates instructor, and so she uses a lot of the movement and posing, posture and things like that. So the two of us have come together, and we have that Concussions Anonymous YouTube channel. But one of our episodes, she led it, was on pacing, and we found that that's something that a lot of our clients will talk about. Is just even booking appointments for them, we had to make sure that, okay, we book in the morning, because if we book people in the afternoon, they've done too much, and the assessment either is a lot slower or it gets postponed to another time. So pacing. Okay. One of the analogies we use to help people understand how the brain heals and how they may need to go through different tints, and we talked about this with the concussions brain healing, is I use the analogy of a cast. So let's say you've broken your elbow. You want to immobilize your elbow. You want to cast that elbow. So the first set of lenses is like the cast. It's maybe more gray or maybe more saturated than what you need 6-8 months down the line. But you need to have that cast so that you can wear it all the time and just help your brain heal.
Yeah.
Once the cast comes off, you don't need it as severe as much. People will get a lighter tint or the gray turned off. We call this the brace. So you want the brace on most of the time. Doesn't have to be on all the time. You can now take it off to have a shower. You can take it off to do certain things. You need to start strengthening the leg or the arm if that's what was broken. You need to start to strengthen it. So you need to take the glasses off. And like you said, I like to take them off sometimes to get some natural light, or to just see, can I tolerate better now, to give it some exercise without the filter. And I think that's a great idea. That's what you do with the brace. But eventually the brace comes off and you just have a tensor bandage, and you only use that tensor bandage when you know you're going to be in an environment that could possibly cause you some harm. So wearing the glasses only when you go to busy environments and stores, but not when you're at home, is great, because you're now into tensor stage. So that kind of 3 stages, it's really helpful explaining that to the physios and the occupational therapists and the rehab doctors, because that's daily what they're doing So that analogy can be very helpful. I find with explaining something like visual stress that people don't really have a concept of, analogies are very helpful. One of the other ones that's really useful is, and I'll ask you this, has anyone ever asked you to try on your glasses?
To try on my glasses?
Yeah.
No?
Okay. So I'll see that in an assessment where mom will say, oh, let me see what everything looks like. It doesn't look any better for me. Well, that's not your color. So it's like asking to try on somebody else's prescription glasses. Oh, you have a prescription. Oh, great. Maybe it'll work for me. And they put them on. No, it's not your prescription. The precision tint is so precise and it is unique for each person. I don't think we've ever had a duplicate, maybe once or twice, close, but different, like you say, different people, different conditions, different prescriptions combined with those tints. So similar to prescription glasses, you can't put on somebody else's and have them work for you. So
yeah, for sure.
That's another one. I want to get your input on this and maybe what you do when people ask you, but I know at the clinic, when people see their glasses and they go to put them on, they think, oh, these are whatever color, purple, green, orange, yellow. What will people say when they see these? Will they ask me questions? How will I answer them? Have you had experience with this, and how do you respond to the inquiries?
When I first got my glasses, I thought they were really dark. I was really surprised with the color. But once I put them on and I was in a busy environment, I didn't really care because I felt good. So it was just like, if someone asks, I'll just tell them. I have been on the first couple group Zoom calls I had. I could tell people were curious. So midway, I just took a pause and said, just so you guys know, this is why I have my glasses. Usually just say visual stress or concussion. I just kind of keep it a one-liner. I think for me, my glasses, I have a fair few conditions. I fall in multiple categories. So for me, it's not really a straight and narrow answer, but you can just give a quick one-liner to people. And if they want to know more, you can definitely open up that conversation because like you said, it's important to educate.
Yeah.
It doesn't bother me to share.
That's good.
And I don't always wear them in every call. If I have a short call, sometimes I wear my regular glasses that don't have tint. It just depends.
Okay.
So.
I had one of our clients recently is a healthcare provider, and she does Zoom calls with her patients, and she said, I don't want them to ask me like what's wrong with me. I want to be a healthy healthcare provider. And I said, well, if anybody asks, just say, I am sensitive to the computer screen and these help me get through the calls. Like, that's it.
Yeah.
You don't have to explain that you've had a concussion or that you have Lyme disease or anything like that. Just I asked my son what he would tell the students at school, and he said, oh, I just told them I got headaches, and when I wear the glasses I don't have headaches anymore. Okay, end of conversation, right? So it can be as easy as that, and it shouldn't be something that makes people afraid to do because it will help. And I think that the level of help overweighs the level of embarrassment or concern or something like that about wearing them. I should address, though, the saturation is, for some people, we can't see their eyes because they are deeply saturated. And that can be something that upsets people in like a sales role or a customer service role. They feel like they're uncomfortable not having eye contact. But the latest analogy I have for that is when you meet somebody for the first time, you can put your mask aside if you're social distance, say hello, and then put your mask back on. That person has now seen you, and you can go about your business. So the same thing with the lenses. Hi, I'm so-and-so. Nice to meet you. And then put your lenses back on.
I'll sometimes start a call without my glasses on just to say hello to everybody, and then I'll put them on, or sometimes I take them on and off through the call because you do sometimes want that, because I know you can kind of see my eyes, but like you said, you do want that eye contact and you want to make that connection. So usually, like you said, just that first meeting or that first interaction, just so you can acknowledge the other person. And
that's good. And then go about your biz, put your glasses and your mask on. So Christine, you're very fortunate to have a mother who is a case manager. And I know for many of our clients, having somebody help them navigate through the process has been really instrumental in their healing.
Yes.
What would you recommend to people? How would you suggest they do that without a mom case manager?
So yes, my mom was a case manager and she did help case manage me for the first while, but we did end up hiring a case manager because that mom needs to be mom and case manager needs to be case manager. So
good point.
We did end up hiring a case manager who was more specialized with the schools, which was helpful because I did go to college and I am in university now. So I did learn a lot with that because it was really important to get accommodations in the workplace.
Yes.
Post concussion. So I would recommend getting a case manager. I know, you know, you don't have to have one long term, but I think especially in those initial days, if you have a multidisciplinary team, it can be really overwhelming doing post-concussive treatment. I was in therapy like 4 or 5 days a week, seeing all sorts of practitioners, and it's like a full-time job to recover.
Yeah.
And you need like one central unit, one central person who can say, okay, you have go to this person for this, you go to this person for this, and who can kind of keep everybody in the loop. Because when you're working on the brain when you're working on anything in regards to recovery, you really need your practitioners to talk to one another.
Yeah.
And so a case manager allows for that communication between practitioners, which I think is really key. And then especially with the school piece or the work piece, whatever that might be, they can be really helpful with that. So I would highly recommend getting a case manager.
That's a great recommendation. I have been invited to by a case manager to case manager meetings. So they've had the physio and the OT and the speech language pathologist, and having all of us there together to talk about the same person and the same symptoms really helps everybody cross understand what's being done and partner together for a better service. So great idea to hire one.
For sure. When I started having seizures, I went to him for a huge assessment, and everything was supposedly fine visually. But post-concussion, I was followed by a functional neurologist in the Guelph area.
Guelph, okay.
And he followed me for years and was very helpful. And they're not like intense, like a lot of therapies, they just want to like hit everything really hard, and your healing brain is not like that. Like, you've got to take it's slow, and you've got to be consistent. If there's anything I've learned, it's those two things. And you want to just ram through and get better, and your body doesn't work like that.
Yeah.
You have to just be consistent. And I find with the functional neurology, it's lots of small things on a regular basis. Okay. And that was really helpful. Where vision therapy can sometimes be a lot. Like, I used to do an hour of vision therapy on Fridays, and I would sleep the rest of the day. I'd be ready to just like fall over and throw up at the end of it. I was just like, awesome.
When I met with a vision therapist, and he demonstrated to me some of the exercises and some of the things they go through with their clients, their patients. And I'm looking at these things going, okay, black and white patterns, balls moving in front of their eyes. They have to walk while they're doing something. I'm thinking, if these people have visual stress, this is going to be so hard for them. Like, really, like, no wonder some of them just say, I couldn't go. It was too hard. Well, to be looking at what is exactly known to be a trigger to visual stress, it's understandable that they'd be uncomfortable. So yeah, and then pushing it hard so that they keep doing it could set them back. Yeah, it did help me, but you have to learn kind of what's the limit for yourself, and that can be a really hard process, because you can have setbacks, and then you don't know if it's just a little flare or if you've went back a lot. And working with different therapists, you'll notice I notice big difference. They're doing very similar things, but their approach can be very different. And so the team's very important too. And that's where individual, not every practitioner is going to be great for every person, right? There needs to be that good practitioner and patient fit. Which means you have to go out and almost interview the care providers as you're going. Patients don't know that. Yeah. Patients think they're the professional. And I used to be the same. You're like, I'm paying this person. They know everything there is to know. I'm putting all my trust in them. And you can't. You have to do your own research. And like, you have to interview them. And if it's not sitting well, like instinctively you want to just trust them because they're the expert. And it's not always the right fit or the right time too. You can also meet the right person at the wrong time in your treatment, which has happened to me. And sometimes you need to see somebody later if you're just not ready. So yeah, that's true. I had vestibular issues, benign positional vertigo. Mm-hmm. And it took me almost 2 years with family doctor and brain scans and physios, all sorts of different specialists to try and figure out what was going on with me. Why did I have this vertigo? Pregnancy test. I'm not pregnant. Like, there's something else going on, until I met the right physiotherapist who just asked me a question and I answered it, and he goes, oh, okay, well, you have positional vertigo. Hang on, let me put you through some positions. Crystals.
Is that what you
I
had? And just
walked
had to
out
throw
of
you
there.
around?
Yeah, I walked out of there without the vertigo. So finding the right person to help.
And post-concussion, they'll do that. They did that to me. I'm like, what are you doing? Like, you're going to make me so much more, because I did not have that, but that's one of the first things they usually try in physio.
Not
But
all
vertigo,
physio.
no, well, I had been to a couple, and they'll even at hospital, they're like throwing me in all these maneuvers. I'm like, what are you doing to me? Like, I am gonna like pass out. Like, I don't have whatever this thing
Yeah,
is.
crystals. It's the
Yeah.
crystals. So, what was the question? Oh, you mentioned as one of your conditions that you have is Lyme disease. Now, you have that amongst a couple of other things, so the concussion as well. In the clinic, we've had experience helping people with the filters who have Lyme disease. But it must be hard for you to tell what condition is causing which symptoms.
Yep. It's just like when you're going through treatment and you're on a whole bunch of medication and you don't know what medication's helping what symptoms.
Okay.
I think for me, concussion, I got to a pretty, I kind of hit a plateau with concussion treatment after a number of years. I did a lot of treatment. I learned to compensate. I learned to pace. I learned how to live with my brain injuries. And so, but when I moved to university, there was just a big increase in symptoms, and there was new symptoms, and things just weren't making sense. And then when I started having seizures, everyone tried to kept connecting it to back to brain injury or pinning it on psychological distress, and it wasn't sitting well with me because I didn't have the psychiatric presentation or the psychiatric stress, and I was 6 years post from 2 brain injuries. And so that's when I started to dig a little bit deeper. And actually, it was one of my functional neurologists who said, I think you should get tested for Lyme disease. And people kept mentioning Lyme disease, even at hospital, but then they wouldn't test and we wouldn't talk about it again. And so then I eventually went and just paid out of pocket for a test, and that's how I got diagnosed. But it is a bit hard. I also got diagnosed with Bartonella, which is a co-infection of Lyme disease. So that means that a tit can have Lyme and all these other things. So one of those other things can be Bartonella, which I have. Bartonella is known to cause a lot of neurological issues, but you can also get neurological Lyme symptoms. And so it's a little bit hard to know what's what. And as I go through treatment, my hopes is just to clear symptoms.
Yeah.
It's going to be really hard to pinpoint because there's a lot of overlap. And the other thing that's really interesting to me is post-concussion syndrome symptoms and Lyme symptoms. There's a lot of overlap when it comes to the brain stuff. And so that's really interesting to me because I wonder when did it switch? When did the Lyme come into play? I have no idea. So
that's a really good point. And actually, it's something that we talked about mentioning here is that it's not that the filters help Lyme or concussion or Bartonella or ADHD or autism.
Yeah.
The lenses help calm the brain. And many conditions have a tendency to have a hyperactivated visual cortex. So it's not a condition, it's all of the conditions that have that tendency for visual disturbances, visual overwhelm, perception of movement, headaches, light sensitivity. All of those symptoms are common. As you mentioned, Lyme disease and concussion have a lot of overlapping symptoms. So do ADHD and autism and learning difficulties and migraines and epilepsy and chronic fatigue. It's a really long list, but it doesn't mean that lenses help all those conditions. They help the common part, which is the visual.
Yeah, and I think, when you have, whether it's whatever kind of illness or an injury, you're going to have stress to the body. And if you have, overactivation of your nervous system, whether it's your visual cortex or whatever, even just calming down that visual system, I would think in turn would help other parts of the brain as well. And it's kind of like, boosting your immune system while you're treating something to support the body, or you're taking vitamins to supplement. You're not directly treating the condition. Like I take all sorts of things to support my body while I'm dealing with the Lyme disease stuff. It's, my vitamins aren't targeting the Lyme, but they're helping support the body while I heal from Lyme. And it just makes that process easier. And it's the same idea with the lenses. to support the nervous system and to calm the system down so that you can go in with other things. Sometimes you just need time. You might need other interventions or other therapies, but that can just kind of help, make the process easier on the patient, which is great, and hopefully expedite the process a little bit.
That's a really good point you make about it's calming the brain in the visual area, but then that could also calm other areas. And what we find is a lot of our clients have sound sensitivity, and they report back that the lenses helped reduce their sound sensitivity because it basically just lowers the hyperactivation of the brain itself, giving it more tolerance, more ability to tolerate the triggers. Good point. Thank you. Something that we suggest to our clients is if they've had an optometry appointment before their concussion, they need to go and see an optometrist after their concussion. But it's better to go and see someone who specializes in post-concussion rehabilitation because there's a lot more involved in testing the visual system than just what kind of refraction correction you need.
Or do you have a healthy eye kind of thing?
Yeah. Like your eye, all this is great, but what about all this and this back here?
Yeah, you have your normal eye assessment, and they're like, you're good. And I'm like, I don't think so. There's a lot going on here. And then you go see someone who specializes. And it might, like, I remember some of my prisms were like super minor, supposedly, but I remember putting them on and be like, holy cow, like it's like a whole new world. Like it's an adjustment in prisms, but they work really well. Like I was in multiple sets, but yeah, you need that specific assessment.
Yeah, from a specialist. That's true. So, well, thank you very much, Christine, for your time and for joining me today on this, my very first podcast/video for Visual Stress Canada. I'm very grateful to know you, and I'm very encouraged by you and your work in yourself and what you're studying and how you're going to help people that way as well. So thank you very much, Christine.
Karen. I appreciate the opportunity.